Hello, I'm Vicki Mabry. Welcome to Healthy Minds, a series from the Janssen pharmaceutical companies of Johnson & Johnson, focusing on key issues in neuroscience research and treatment of brain disorders. Today's segment focuses on treatment-resistant depression, how to recognize if you're suffering from it, and how cutting-edge science may be able to help. I met with Dr. David Hough, who's a psychiatrist and clinical researcher at Janssen, to discuss how this disorder is treated and what the future may hold for patients. What is treatment-resistant depression and how does it differ from regular depression?
Well, regular major depression is a biologic illness which has a constellation of symptoms. Treatment-resistant depression is a subset of major depression, and it includes people who have been treated with 2 or more treatments for depression, but really haven't responded adequately. About 300 million people globally has major depressive disorder.
300 million people. And then treatment-resistant depression is a subset of that.
In the US alone, we're thinking it's about 30%, so about 6 million people.
So what actually causes or contributes to depression being treatment-resistant?
It's a multifactorial illness, and for some people, there could be a strong family or genetic history, and in other cases, a particular stressor that the person has undergone.
This is an illness. This is not a character flaw, correct?
One of the challenges we have is about stigma, and it's helpful to explain to the patient that this is a biologic illness.
For people with treatment-resistant depression, how do you know what is actually working in the brain?
You try to target the medications according to the symptoms that they're experiencing. If they're experiencing more anxiety, if they're experiencing insomnia, or if they have chronic pain. But we have to help people understand it's not just about the medications. They have to take good care of themselves.
What can you say to a patient who tried multiple treatments and just nothing has worked?
I try as best I can to offer hope to patients, to tell them that there are a variety of options out there and that we'll stay together on this journey until they get to the point of recovery.
What new kinds of medicines are in development?
We're trying to help different nerve cells communicate with one another and different areas of the brain communicate with one another.
For people with treatment-resistant depression, is there reason to have hope now?
I think there is. There's a lot more collaboration these days and sharing of information between government, academia, and pharmaceutical companies. And I think there's a lot of new excitement in the field in the last, say, 3 to 5 years in mood disorders.
So what do you do if you or someone you know has treatment-resistant depression? Seek help and don't give up hope. I'm Vicki Mabry for Healthy Minds. Thanks for joining us.